Welcome to another episode of Dr. Dallas Unleashed.
Yeah.
And today joining me, I have Dr. Rejuvenation.
Dr. Rejuvenation in the house. We're giving Dr. Dallas a break. Actually, he's released me from quarantine, so I'm back.
So you're back from quarantine. Well, that's great.
Yeah.
But, I mean, we've been back for about a month now, but we never got to know what you actually did during quarantine. I know we heard about Amber, we heard about Dr. Dallas, we heard about me, maybe a little bit from Quentin, but what did you
Where
do?
do I start?
Right.
Where do I start? Well, this is what I learned from quarantine, you guys. I learned that I'm not cut out to be a stay-at-home mom, i.e. substitute teacher, chef, maid, wife. It was way too much for me.
Oh, yeah. Filling all those positions has got to be extremely hard because you're doing everything.
Yeah. Kudos to all those moms that are actually like stay-at-home moms and homeschool. I mean, forget it. It takes a whole nother skill set for sure. Right. And then I always felt like the house was never clean because like everyone was home 24/7.
Yeah.
And so we were cooking, cleaning, dishes, everything.
Oh, yeah.
So I'm happy to be back at work.
Oh, we are glad to have you. I know you guys were doing a lot of TikToks too. You made the healthy coffee.
So fun.
You guys did your anniversary.
Yeah.
We did some fun stuff. We got into TikTok. But what about like teaching the boys? How was that? Were you helpful? Were you good? Did they like it?
It was tough.
It was tough.
You know, luckily we only have 2 boys, so we could be like one-on-one. So Dr. Dallas had Luke and then I had Nico, and so we just kind of divide and conquered, but like it takes so much patience to sit there and then keep them entertained like every minute of every day.
Yeah. I mean, I don't know. I know I don't remember my like 5th grade math or my 3rd grade spelling and all that stuff. And
luckily you had Riley. It's much easier having a puppy.
Oh, it's Wrigley. You know,
Wrigley.
Like close.
Riley.
You know, I did have to train him during quarantine, and that was tough because he's still bad to this day. So we're working on it still.
He's gotten better.
He's gotten so much better. I can't even lie. He has. I'm proud of him. But yeah, I know you guys did some new recipes as well. The healthy coffee, and you had to become a full-time chef. So was it easy? Do you guys all eat the same? Do the boys have to adjust to the way you and Dr. Najera eat?
You eat whatever I cook, or you just don't eat.
That is true.
Actually,
That's how
they're really good eaters, though.
Oh, good. So lots of veggies, and they like tofu?
They don't like tofu, nor do they like mushrooms. But I always say we eat everything.
Right.
But the thing is that they eat, and then shortly thereafter, like minutes later, they're like, "Oh, I'm hungry again." Right. So then there's lots of snacks.
Yeah.
Lots of snacks.
Big snackers in the house. Well.
And then I gained the quarantine 15. Like who didn't gain the quarantine 15?
Literally, I know I did. We talked about it. I was eating like no other. I bought so many canned food, so much box food because I had no idea. I've never been in a quarantine. I don't think anybody has. I'm like, are they going to shut down the store? So I went and I bought 12, 15 boxes of pasta.
You're responsible for all the empty aisles.
Right.
Like there's no pasta, there's no sauce, there's no eggs,
literally
nothing.
I took the cans of tuna. I took I even have chicken ramen. I don't even eat chicken, but I bought a case of ramen. My mom was like, get a case just in case. You never know what's going to happen. So here I brought it to the office so everybody can have it because I'm not going to touch it. But
I love some ramen noodles, y'all.
I know. I mean, they didn't have any veggie ones, or like even the shrimp ones I'd get. They only had the chicken, and it was like one of the last boxes. And I was like, I'm not trying to starve. So, but we're glad to have you back. I mean, I love being back at work.
Thanks.
Even though
I'm happy to be back.
Yeah. I mean, home was boring for me a little bit. So, you know,
me
I
too.
like being here. I'm socialite.
Happy to be back. I'm happy to be operating again. It's been super busy.
Yes.
So vaginal rejuvenation has been really popular because I think in quarantine life, people are a little bit more active, which is always a plus. And so there's nothing wrong with like keeping up your sexual well-being.
That is right. Definitely not, especially during quarantine.
For
and
sure.
I know some people are not back at work. So how would you tell anybody, like, when is the right time? How do you know when it's the right time, or if you want to do vaginal rejuvenation?
Well, I think, you know, when we talk about vaginal rejuvenation, for me, like the 2 most common categories are 1, vaginal rejuvenation for vaginal tightening. So especially during quarantine when everyone's a little bit more sexually active, then you kind of realize, gosh, I wish things were a little bit tightened up down there. Things have kind of loosened up as I've gotten older or I've had kids, and things are stretched out and relaxed. And sometimes like your spouse or significant other may not tell you that, but it's just not pleasurable for you, and you know the difference. And so those are the most important reasons really is that 1, do it for yourself, not for someone else. But I always say it is a 2-for-1 surgery. So not only will you benefit from it, but your significant other other will benefit from it too. So that's one category. So we can do surgery. So I've been doing a lot of vaginoplasties lately, just to surgically tighten up that vaginal canal and at the opening to make sex more enjoyable for both you and your partner. Or if you wanted something less invasive, there are lasers that we can do in the office over on Atomic Beauty Med Spa side. Tighten up the vagina. Results last on average for about a year. Nice. So then you're coming in once a year just for like a touch-up treatment. But what's nice is that there's no downtime. There's no pain. I actually felt like it felt really nice down below to have some like warm laser treatments. Kind of feels like a hot stone massage down below. You can't complain about that.
No, you cannot.
But it's really nice to be able to kind of, put some spice back into your sex life, which I think is like so important, but really has become more popular during quarantine life for sure.
Absolutely. I feel like as soon as quarantine was over, people realized like we need to do something about this. You're right. Maybe it's not pleasurable for both your husband and you. And now it's time to find somebody who knows how to fix it down there.
And sometimes like your significant other may just not feel comfortable saying something about it. And sometimes that's smart because you don't want to hurt your, hurt your woman's feelings. But surprisingly, I have a lot of like husbands who actually do all the research and find me and then tell their wife, hey, you should go see Dr. Rejuvenation. She's the best at what she does. And so I love that. Like I love when two people are on board and want to kind of perk things up down below. We also, on the other side of what I do though, is the rejuvenation shot or the O shot. So that's also become really popular and people are like, well, what's the rejuvenation shot? Basically, if you don't know what the rejuvenation shot is, we take a small blood draw, so a small sample of your blood, and we spin it down. We take the PRP, which is the liquid gold, your platelet-rich plasma. Yeah. So PRP has been used for medical reasons throughout the entire body for multiple purposes. But believe it or not, you can actually inject it right to the clitoral area and then to that sweet G spot.
Yep.
And then it basically does its magic over time. So more intense orgasms, easier to achieve an orgasm, increases the blood flow to the area just to make things more sensitive down below vaginally. Right. So that's always appreciated. But the other category of what we do is like labiaplasties. And so that's also been really popular. And I think vaginal rejuvenation thankfully has become much more we're much more socially aware and much more comfortable talking about it. But especially during quarantine life when we're working from home, no one needs to know that you took time off to have surgery or why you had surgery. And so it's been really, these are nice procedures where like if you did a labiaplasty, you're just taking 3 to 4 days off of work and then vaginoplasty just a week. And so it's a great time to kind of recover because you're quarantined anyways.
Yeah, you're at home.
Yep.
Hanging out.
So sometimes I kind of feel like though too, it's interesting. It's come up in discussion, am I vain to consider having vaginal surgery down below or even for that matter, any kind of cosmetic surgery, whether it's breast, body, face? Thoughts about that?
I mean, I personally don't think so. If somebody wants to make a change for themselves, I say go for it. That's your body. You want to feel confident. You want to make everything better, regardless if it's a vaginoplasty or a tummy tuck. That's up to you. As long as you know that you're doing it for the right reasons and you're doing it for yourself, I'd say go for it.
Totally. I totally agree. And I think as an outsider, sometimes people perceive it as, oh, well, you're trying to, like, are you trying to make things look like a porn star down below or even like in terms of a breast augmentation? Yeah. And I would say almost like 100%. I can't think of one person that's brought in a picture and it was like, I want to do this because I want to look like so-and-so.
Yeah,
you know what I mean? It has nothing to do with that. It has to do with feeling like I've been embarrassed about the way it feels or looks down below. It's sexually, it's inhibited me from feeling confident. It's uncomfortable. It shapes when I exercise. There's so many reasons why women get cosmetic surgery, and I think it's a shame that sometimes we're shamed into thinking that it's, poo-pooed on because of like the way, the public may perceive it.
And I don't think women should ever feel uncomfortable, especially in their own skin.
Absolutely.
If they want to make the change, I say go for it. And if something's uncomfortable for them down there, especially during a workout, that's so common. Most women, if you want to work out and it's uncomfortable, you already know that that's an issue, and there are ways to resolve that. Same with just even a little bit of leakage or anything to help prevent it. So there's a lot of benefits out of doing a labia or a vaginoplasty. There's a lot of benefits of the laser. So it just depends on which route they want to take, right?
Yeah,
and if
absolutely.
you don't want to do surgery, you don't have to.
No, and don't let a man tell you too that you know,
Right.
things are great down below. You don't need to do anything. Do this because you're going to do it for you. I had this lovely patient that I'll never forget. I operated on her years ago, and the very next day she woke up and she was crying, like just Niagara Falls, tears. And her husband, true story, was like, "What is wrong?" And she's like, "This is the first morning that I've woken up and I kind of feel like I don't have all this extra skin and I can actually wear my tights to work out." I mean,
amazing.
it's life-changing
Right.
for women. And so I celebrate the fact that we can actually, you know, have the option to be able to, like, you know, have surgical treatment options available for patients. But also, I'm so happy to kind of see that now there's more social media awareness and that women can feel comfortable knowing that there are actually options if you do feel uncomfortable down below.
And then, I mean, if anybody ever wants to know kind of the procedures, besides following our Snapchat, you can always check out our YouTube page because we do the diagrams. We have live surgeries. We have different ways to show exactly what you do and what to expect. I mean, just kind of like after surgery, or if somebody decides to do surgery, what can a patient expect going into it, and then like the process, and then after.
And that's been really helpful. I've posted some YouTube on my YouTube channel. There's lots of videos about like labiaplasties, vaginoplasties, also where I'm doing the rejuvenation shot, or just answering some common like GYN questions that you've always thought about but might have never known the answer to, or been too uncomfortable to like ask your gynecologist. I think that's really helpful too. And it's really amazing. Like when women, and I see women from all over the world who come to see me for vaginal surgery, but I always think it's interesting, like women do their research before they come and see me, because they'll call me and be like, "Oh, well, I know you do this type of stitch when you're doing this type of procedure." And I'm like, kudos to you. Like, do your due diligence, find a surgeon who you're comfortable with, but also that, you know, is reputable and has done a lot of what they do. So, I mean, that's what kind of, I think, separates me from someone who isn't as comfortable doing vaginal surgery, which unfortunately, as a plastic surgeon, some of them have different expertise, like Dr. Dallas, breast, body, butts. That's his thing, right? Yeah. Some plastic surgeons, their expertise may be face. But for me, I'm purely cosmetic vaginal surgery. And so I think that's why we're such a good duo, right? Like the complete mommy makeover. I take care of everything down below the belt.
Yeah, everything. So, I mean, if you guys are interested in coming in and getting a full new body, so breast, tummy, butt, you can also take care of the vaginal part. So after you guys have kids, you know who's got you. Dr. Rejuvenation's got you. So after, let's say I decided to go forward with a vaginoplasty. What is it like after? I know we need to recover for about a week. How can I use the restroom? When am I able to have sex? When can I work out again? I think those are some common questions
those are great questions. So after a vaginoplasty, everyone is going to be, I always say, you're stuffed like a turkey with this like long piece of gauze inside your vagina to kind of take care of any bleeding. That you'll remove the next day. You will automatically go home with a catheter. Okay. But you go home with a catheter for about 4 days, and that's just because there's so much swelling sometimes after surgery that it prevents you from being able to empty and pee completely. And so temporarily I have a catheter in place. What's nice about that is, guess what? You don't have to get up to go to pee.
Right.
And so that all kind of drains into the bag. And then after 4 days, you come in the office and then we remove that catheter. The pain is not that bad, you guys. And so usually I find that patients are taking the stronger pain medication for maybe a week, some more, some less. But I usually operate like on a Monday or Tuesday. You're back at work the following Monday. Yeah. If I was just doing a labiaplasty, then actually I find that some patients are just taking the Tylenol and ibuprofen. That's not terrible at all. So it's not as painful as that may seem. And there's not that much downtime because you're going to be up and walking the very next day. The post-op instructions, yes, I usually say about 4 to 6 weeks, no sex, no heavy lifting, no lower abdominal exercise during that time period because I just don't want any tension on my sutures. I don't want anything busting apart. But other than that, you're going to be up and walking the very next day and doing your otherwise normal activities. Yeah, so it's an easy recovery. It's not bad. Yeah, not at all. It's not like doing a tummy tuck. No. Probably feel that a little bit more. But vaginal rejuvenation, easy peasy. Easy. And remember, like we could still do those lasers, and those are painless. Yes. And there's no downtime, at least for the Femi 360. Juliet
couple days?
Yeah, a couple days, no sex if we're going to do the Juliet. Just kind of depends on what laser we do. And to be honest, I make that decision based upon what I think is going to be the best approach for that particular patient. Yeah. But the results are really amazing. And I did the procedure. I liked it because, like, again, it feels comfortable.
Right.
And it makes such a big difference. And for me, I used to always leak guaranteed if I was jumping on a trampoline. It doesn't matter if I had just emptied my bladder and I had just peed. It's just that muscle weakness that would cause me to leak. And then if I had like a bad cold or something and I was coughing a lot, then for sure I would leak. But after the laser, done. And for me, that was worth it just for that. Is that annoying leakage? Because you can't even work out without like worrying about a little bit of like drops.
Right.
So frustrating.
And some people will have to wear a little panty liner or a pad, and they're not even on their period. They just want to have something to catch that. And you know, you don't have to do that anymore.
No more, you guys.
It's gone. You can even go underwear free if you want.
That's right.
So I think that, you know, if you're interested or women are, you know, self-conscious down there, you shouldn't be. It's completely normal.
So normal. And it's unfortunately not one of those things that we sit around the lunch table and talk about, right?
Even though I guess you probably really could, because I feel like women, when you go into the bathroom, when you're at dinner, lunch, you could sit and talk about those things, and it is completely normal.
Yes,
I think so.
Totally.
I'm just saying.
You know what's interesting to me too is how many things like these intimate topics you'll either share with the person who waxes you,
right,
or cuts your hair.
Yeah. Yes, I do. Well, I don't get my hair cut, which I should.
You don't cut your hair?
I haven't cut my hair in so long. This is
really?
From, you know, when I started here, my hair used to be, okay, so back in college, my hair was bleach blonde. And then
I remember that.
I let it grow out. I didn't dye it. I just let it grow. So it was kind of, you know, let my roots grow. And then I think the blonde just broke off. And now we're completely brunette.
You have such healthy hair. You don't even trim it?
No, but I know I need to. But we're finally at a point where it's actually long enough to where I'm like on the verge. Like, yeah, I like to wear extensions every once in a while to give some thickness to my hair. But I feel like the length is getting there. It used to be like literally right here. It was awful. And I never cut it. I cut it back in high school, but I never cut it like in college. It was just breaking from bleaching it so much, or like dyeing it blonde.
Well, look how much money you're saving.
Oh, I know. Arms and legs. I'm saving arms and legs because of how much it was. So, yeah, but you know, I don't really cut it. So who I would share this with would probably be my friends. I talk to my mom about it a lot. And then, you know, yeah, I mean, I wouldn't go and tell my male.
I wouldn't be able to talk to my mom about that. She would be like,
well, I don't have any kids, so it's a little different. But I'm like, hey, if I'm considering doing this. So like me and Dr. Dallas last time were talking about how she was my biggest support system for my breast augmentation. Well, if I were to move forward, if I wanted to do another surgery, that would be my support system again. So this lady's got to know, like, if I'm going to do something, she's going to know what it's going to be. So.
Your mom's the best. I love your
awesome.
Mom.
She is awesome. Shout out, Mom. I know you're going to listen to this. You always do. But no, I think that women, you know, if they want to, especially after kids, you know, they're losing.
Your whole body changes after kids, you guys. Like, to all of us, right? Like,
100%.
Everything changes. Your skin changes. How you metabolize food changes. Yeah. I feel like everything goes south after children, period. And so I think, you know, and unfortunately, I think as a mom, like, you're the last person on the totem pole. We always put ourselves last. And so at some point, you got to put yourself first. And I feel like there's never a good time to do surgery or take time away for yourself, but sometimes you just have to do it. And I think that one of the things I learned from quarantine life for sure is that there's so many things that I took away from quarantine life that I'm so glad that, you know, despite it all, and these are such, you know, weird, difficult times in general, but one of the takeaways for me was like, you just have to, even if it's 10 minutes that you kind of carve out for yourself, whether it's, you know, working out or meditating or whatever the case may be, you just need it for your own sanity.
Yeah, I 100% agree. I was one of those people that started doing yoga during this time frame. So I would just like a deep stretch in the morning, something just to kind of like relax your mind. And I never take that time to myself, but I feel like I had kind of time to get up, to make breakfast, to start my day off with a little bit of yoga, come out, see the weather every morning, because that's how we started our snaps, and then do my at-home workouts and, you know, take time for yourself. I think that was really important in quarantine, even though I'm sure you were slammed. You had Dr. Dallas and the boys, and but I mean, I'm sure in that small time period, you know, there was like a little bit of, maybe, I don't know if there's any time for you.
No, it's been great. Like we bike now more than ever.
Oh, yeah.
So I grew up playing tennis in high school. So now we're playing tennis all the time.
Oh, nice.
So even if I'm like, I'll be like, okay, I'm going to go hit the ball against some walls by myself.
Hey.
But it's brought so much joy back into my life in terms of the things that I used to not do.
Yeah.
And now I'm able to kind of make the time to do it for myself. I think it's super, super great.
I think that's great. I mean, I think overall, quarantine, I think, has been good for everybody because you get to take that time, the family time. And like I was telling him, I mean, I got to really connect with my dog. And so I think when I'm back at work, he's so sad because he's at home by himself. He's just hanging out.
So lonely.
But, I mean, we used to go on long walks throughout the day. I used to take him for like a small run every once in a while. He was smaller, so it'd be tough. So I couldn't go as far. But just for him to be more active rather than just chilling at home by himself. I mean, you know.
Wrigley's sitting at home right now. Oh, where's Ange?
Right. Where is she? Where's mom? Like, and when I get home, it's like, mom. And he's like, we all call him the dodo because in his head, it's like, do. It's like, we don't know what is happening in that little head. So I think during the quarantine time, I trained him a couple like different things like sit, shake, lay down. He's not barking as much at people because that was a big thing. I like don't want him barking. But, you know, he's learning. We're getting there. We're not there yet, but we are getting there.
He's so close.
He's cute. He's a cutie. He's a unique one. He definitely keeps me on my toes, and I like it because he's a challenge. But those days when you're tired from work, you just want to go home and no, not with this one. You don't get to do that with him. He's like, mom. So
you need another one.
I do. I need another one to balance him out, and they can play all day.
There you go.
I thought about it. I've been thinking about it, so we'll see.
On the lookout, you guys.
Yes. But, so you guys know all about vaginal rejuvenation now. We know that we offer the lasers, the surgery, what the recovery you can expect for that, kind of what you need to do and when the right time is. And if you guys are interested, which you should
learn more. So get on our website, check out my YouTube channel if you want to learn more about the procedures, or just come in to see me for a consultation visit. And now even during quarantine time, I've been doing a lot of virtual consults, which has been really super helpful because actually for me being so busy, I find that doing a virtual consult with physicians is really nice because then I'm not having to like leave my house or leave the office. But we will sit down, we'll review all your pictures, we'll talk about what you can expect, what I can deliver. I think those things are so important so that you don't have any surprises. And then just learn more about us.
Right. So you guys can go to her website. It's vaginalmakeoverdallas.com. Our YouTube is Dr. Rejuvenation, and you guys can head on there and check out any procedures, everything we have to offer, pricing, what to expect, and then see demos as well. So, or you can just follow us on Monday, Tuesday sometimes, and we have those live surgeries. So
on Snapchat, true.
Yep. Real Dr. Dallas. Well, thank you,
It's
Dr.
been fun.
Rejuvenation.
Thanks for having me.
Of course. And we'll see you guys next time.